State your name and specialty.
Carla Terrell, clinical nurse educator.
You're off to a roaring good start.
Thank you. I got those right.
So how often are you involved in caring for breast cancer patients?
I'd say virtually every day that I work, I'm working with at least 1 or 2 breast cancer patients.
You're fine. Am I out of the way now?
No.
I'm not. Oh. Stuck on. You ready?
Yeah.
Find a place to sit.
Somebody stand behind me and hold my jowls back.
You don't need it. You'll have mama.
Ready? Yep. So, as a clinical nurse educator, what are your goals when you help breast cancer patients?
As an educator, my primary job is to work with ladies, breast cancer patients who are getting ready to start chemotherapy. And so we sit down and we talk about side effects, answer questions and concerns that they might have. So my goal is that they go into it before starting treatment, knowing as much as they can and having valid information. There's a lot of information out there that won't pertain to them, and it can be scary. So I want to remove as much of that as I can, so that they're as comfortable as possible.
Great. Are you on the multidisciplinary team?
I do go to the tumor board conferences.
So
yes.
How important is the tumor board to helping provide good care for breast cancer patients?
I think it does 2 things. One, it does give that format for all of the different teams to get together and talk about, debate sometimes, and to learn from the experiences that they've had with other patients. And for patients that are straightforward, there's not a lot that goes on. But when we have the tough cases, it is very interesting, and I do think that the patient gets, they put a whole plan together that involves everybody that is in the know. So from the medical side, it's good, and then it's also good from the patient side. The patient knows that people are getting together and discussing their case, and that they are going to get the benefit of a lot of knowledge from different areas.
We were originally set up in cancer research program area, which was great. There would be no walking through it, but it was very hot.
Sorry.
That's okay.
That's all right.
I wanted it to be convenient for you guys. Kind of out of the way.
It actually feels nice.
Sorry.
It feels nice right here.
Yeah. How's caring for breast cancer patients changed over the last 20 years?
It changes all the time. One of the most notable changes, I think, has to do with the genetic knowledge, genetic testing, and we're learning more and more about the role of our genetics in treating of breast cancer, and those only help the survival of patients, and the medicines being having fewer side effects, and it changes all the time, and that's part of the benefit of working for a breast cancer center that stays current with all of the research, because we know that we are going to be offering the most up-to-date information and treatments.
Great. So, do you have a personal story of someone you know who's faced breast cancer? You have. tell us a little bit about what it's like to get the news, and long story short, how you're doing today.
Well, the first time I had breast cancer, I was 38. I was a stay-at-home mom, not a nurse. I have an English degree. I knew nothing about cancer, really very little about medicine, never had any health issues. And I decided to go back to school and become a nurse simply because of that. It's dramatically changed my life, really for the better. And I do feel like what I kind of bring to the table is having been on that side of the desk, remembering how that felt. And I think it's very encouraging when I sit across from someone who's just been diagnosed, and when they learn that I'm 14 years out from chemo, 14 years out from radiation, and I'm doing fine. And it just lets them know, without saying a whole lot, that their future's going to be okay too.
Well, you help with the LifeSpring support group.
I do.
Obviously, your experience helps there. Tell us a little bit about that and why that means so much to you.
The LifeSpring group, the first time I did it, I was the patient. And so it meant a lot to me back then to be able to be with people that knew what I was going through. And again, knowing that there is life after the diagnosis. So fast forward now, Amy, the other coordinator, and we meet with people with all different kinds of cancer. And we do talk about, what happens after the diagnosis. How do you get back on your feet? How do you start feeling better? And it's a very positive thing. We look forward to it every Monday. A lot of these people form very personal relationships, and it's a very upbeat group. I think some new people come in thinking it's going to be, people sharing and crying, and they're surprised that we're all laughing, and it's a different atmosphere than what a lot of people think going into it.
That's great. I'm sure that's invaluable. I thought about coming when we came back from Memphis. I mean, just, you want that common ground and that empathy and all that kind of stuff. So,
Yes.
1 in 8 women statistically get breast cancer in a lifetime, but if it's caught early, 99% success rate for 5-year survival. What would you say to some lady that's in that demographic that's considering getting her first mammogram? What would you say to her?
I would say, 1, it doesn't hurt as much as some people try and tell you. 2, it's very important just to get your baseline. Most all mammograms turn out just fine. Shouldn't be scary. And if you're going to have it, if one of those women out of 8, you want to catch it early. The best breast cancer to have is an early one because of the dramatic cure rate. So take the fear out of it. You're being proactive. You're doing something that's going to prolong your life. So take the fear out of it, for one thing, and know that you have a full disciplinary team right here in Owensboro that's going to be able to take care of you. You're going to be able to stay here. Most women that go through treatment go to work, take care of their families, and it's just a bump in the road. Okay? All right.
Good deal. You're good. You're good. All right. Didn't want you to hit your head on the...